Okay, so we begin by inspecting the abdomen with the patient laying down, so you can uncover part of their abdomen. Taking note on the symmetry of it as well as the umbilicus, if it's located centrally or displaced at all. Noting any rounding to the abdomen or contouring, discoloration. There's no bruising, discoloration, slightly rounded. And then our other thing that we can do is note venous return and any surface motion as the patient's breathing in, taking note the symmetrical rise with respirations. If the patient raises their head, you can also be using that to detect masses or hernias or the separation of muscles. The second step that we are doing is auscultation with the stethoscope, using the diaphragm of the stethoscope, listening to all four quadrants for vowel sounds. There could be anywhere between 5 to 35 vowel sounds per minute. Taking note of the sound that the vowels are making. And no abnormal findings with that. Switching it to the bell side. Listening for vascular sounds, for any bruits that may be present. There are no bruits or abnormal findings with that. The next step will be percussion, and starting with using either the four quadrants or the splitting it into 9 regions. You can percuss around the abdomen. We're going to use the 4 quadrants and get an overall sound of the abdomen. For tympani, resonance, dullness, taking note of what you're hearing. Any gastric air bubbles or things like that. Noting the liver span, the change of tympani to dullness, as well as the spleen, noting that as well. The last portion is palpation, starting with the lightest touch, using the palmar part of your hand with the fingers extended, and starting with light, you do small circle, circular, 1 centimeter depth of palpation, noting the patient if they have any tenderness or grimaces on their face. And then you can move up towards moderate or deeper palpation using either the side of your hand or just progressing in depth. And this is where you could note some discomfort from the patient or tenderness. Also, you can check for rebound tenderness as you remove your hand. And you can also use the percussion to feel the masses or the organs to feel if there are any abnormalities.